Okay, so we had anterior hip precautions. So some indications, maybe your patient has OA, RA, or depending on the severity, a hip fracture. So you just had a hip replacement here and they came from the front. So there's a few precautions you need to know before we get you up and walking and moving. So one thing is you can't move your hip backwards. So this is what we call hyperextension. So we want to keep it in line with our hip. Also, we don't want to have any excess movement. So this way, we call it external rotation. So we want to be careful of that. Some benefits though for your anterior approach is that there's less risk for dislocation as long as we don't break any of those precautions that I showed you. So when you're going to the grocery store or like opening up a door, we want to make sure we're not walking backwards because that movement can break the precautions. Also, as well as laying on your side or laying on your back while sleeping. Sometimes our legs tend to roll out into that external rotation motion. And also going upstairs as well, we have to be careful because when we take a step, our surgical leg can be left behind while going upstairs. So those are just some daily activities we want to be aware of and be careful so we don't break those precautions. So also we're going to be showing how to walk and get out of bed with your precautions.
Gotcha. All right. Would you be my patient, Miss Summer? Awesome. You'll be a slightly smaller patient today. That's how tall that is. This will be just
I see.
Okay. So, about your precautions, which we've already talked a little bit about, we're just gonna make sure that while we're like turning in the walker, that we're not bringing our legs across one another, so no crissing or crossing. And as we're kind of coming to a stand, that we're not leaving one leg behind us. So just try to keep them both side by side. So this walker is gonna help us kind of move out of bed, and our right leg is our hip arthroplasty leg. So I'm gonna have one hand here on the walker, and let's have one hand here on the bedside. We're gonna use both of those to kind of stand up and out of the bed here. Also gonna use a gait belt just to make sure that I can grab a hold of you if I need to. Mind if I sling this around your waist side? Okay, excellent. How did you get such a colorful one? Oh, did you want like a very cool. Alright. Alright, does that feel pretty snug?
Yeah.
Not too snug?
Nope.
Excellent. Just gonna tuck this in right here. Alright. Now, if the patient had significant lower extremity weakness, I could consider using like a knee block or something. For intents and purposes, we'll say that Ms. Summer is strong as well as her upper extremities. So on 3, I'm gonna ask you to come up into a standing position into the walker. Ready? 1, 2, 3. Very nice. And Jacob, you'll take the gait?
Sure.
Swoopy swap, go for it.
So the gait is going to depend on a couple different factors in the patient presentation. It's going to depend on what their weight-bearing status is, what their other capabilities are in terms of upper extremity strength, etc. The most important thing to remember is that this is a step 2 pattern and not a step through pattern. So to explain that, it was the right leg that had the new hip, right? So in order to get the gait going, what I want you to do is step just the right leg forward and touch the toe to the ground. And then move the walker forward as well. And then put your weight through the walker and don't step past the right leg, step to the right leg. Perfect, just like that. So the forward progression is just going on with the right leg, the new hip, and then the other leg just catches up with it. We do that to make sure that the extension doesn't go past neutral. And then besides that, just being very careful with the turning, because we don't want her turning like this. We want her turning while stepping so that the hip is only moving very slightly each step. So let's try to practice that. Try to turn the walker toward me a little bit and take some very small steps to turn your body. Great. And that's the basics.
Any concerns about getting in and out of bed?
Yeah, so as we're getting back into bed, again, with this right leg being forward, you want to make sure that that stays forward so that as you're sitting down, you're keeping that hip protected. So we can move the right foot forward and take this right hand and get it back toward the bed.
And also with rolling in and out of bed, you just want to make sure that if they're gonna roll, have something between their legs, or just have them long sit while getting in and out of bed.
Yeah, and so this is for an anterior hip approach, right?
Yes.
So you also want to make sure if they're getting out to the right side of the bed, they don't just throw their right leg off of the bed, right? Because then it would hyperextend off, right? And you went over external rotation. So when they're standing and they go to turn, you don't want them to externally rotate out. So you almost tell them to take a wide turn when they go, if they have to turn towards their surgical leg. And why are we doing a step 2 versus step through? Did you say, Jacob?
Yeah, because I don't want to get the hip at past 90. So by starting with the right forward and then catching up, this hip never goes past neutral.
So we always want to encourage normal gait pattern right out of bed, right? Because that would mean she can't walk normal for 3 months. So when we walk, we're not necessarily hyperextending. Like we're talking hyperextension like this. We don't walk like this, right? I'm glad this is on camera. I know now why. I think there was a question on one of your Jerry exams about walking upstairs with these precautions. Stairs aren't too much of a concern unless you're taking huge steps up. Your leg can go a little behind you. You don't want to hyperextend it. It can extend, we just don't want hyperextension. So when they first get up, we want to encourage a step through.
Okay.
Okay? Normally they're going to do a step 2 that first time you get them up. They're pretty antalgic, but step through is what we want.
So just to make sure I'm clear, how much extension is allowed?
It's normal walking is fine.
Okay.
We tell them like if you're going to be doing yoga or kicking a soccer ball, don't do it.
Okay.
Understood.
Yeah. And I'm going to post something that we hand out at our hospital on Canvas so you guys can see what we tell our patients. Good job. Thank you.